The data I want to present today is from a national cooperation project, the CRONMAS project. During this meeting, we have been talking quite a lot about the udder, which is, of course, the central organ of the postpartum dairy cow. We have heard about non-severe clinical mastitis, about selective drive strategies and udder edema, and a lot of other things associated with this organ. But I would like to draw your attention that there is something else associated with the udder except mastitis, which is the calf. As we take away the calf, we drink the milk ourselves, we have to face, of course, the problem of mastitis. And mastitis often does not come alone, but bring its friends, retained fetal membranes, metritis and ketosis. So soon enough, we have to take decisions with economic impact on the farm. As you all know, that improving bovine health postpartum could be very helpful, or is in general helpful, to reduce the usage of antibiotics, to augment animal welfare, to have better fertility rates, and to improve the economic feasibility of the dairy farms and the dairy industry in general. So we asked ourselves whether it is possible to have healthier cows via genetic selection. So how did we do that? We knew from former studies that genome region on bovine chromosome 18, which is relevant for fertility and udder health. And our colleagues had searched the national database to select sire haplotypes. In this selection process, the somatic cell count served as a surrogate for the udder health and for mastitis incidence. So what did we exactly do in our experiments? We searched again the database, the national database, for suitable sires with several selection criteria and their daughters. As we had identified daughters which we could use, we had to contact the owner to ask whether this specific heifer would be for sale. We wanted them to be at least 18 months old, to be pregnant, and then, if that was the case, we went to the farm and had them blood sampled and performed pregnancy diagnostics. So those from which we obtained the blood sample, we did perform genotyping of those candidates to identify whether they really had the haplotypes we were searching for. And in the end, we ended up with 36 heifers from 6 different sires, and all of them were half sips. So in my talk, I will always compare the favorable haplotype heifers to the unfavorable haplotype heifers, and the favorable ones are marked in the graphics with an uppercase letter Q, and the unfavorable haplotype heifers are marked with a lowercase letter q. And I will compare them to answer the question of our project with whether those favorable and unfavorable haplotype heifers differed concerning their clinical performance postpartum. So we bought those 36 heifers and we brought them to the clinic for cattle in Hanover. And we supervised them quite intensively. At arrival, we performed a very detailed general examination, which was followed by an adaptation period. We also had a claw examination to make sure that we do not oversee anything. The experiment started 3 weeks before the expected calving date, and we always compared, or we differentiated between the part antepartum and postpartum, so before calving and after calving. And I want to supply you also with the information that those animals received an intramammary challenge before they were necropsied on day 40 after calving. And we also performed a parallel long-term experiment, which did not take place in the clinic, but outside on a farm, with 6 animals, 3 of each group, which were from the same selection process. And we supervised them for 2 lactations without any intramammary challenge. But due to time limitations, I cannot go into detail about those 2 aspects, but I will focus on the short-term experiment. So, as I said, we were looking for them quite intensively. From the start of the experiment, we did general examination every day. We measured the rectal temperature 2 times per day. We did rectal ultrasonography at least once per week. We did body condition scoring. We did take the weight, etc., etc. We took blood samples 2 times per week and milk samples one time per week, and in any case of any disease, treatment was performed according to good veterinary practice along a specific score sheet to make sure that everyone received the same treatment procedure. So let's come to the results. At the beginning of the experiments, those 2 groups were comparable concerning general health, concerning udder health, concerning age at insemination, and so on. Around calving, we detected that the calves of the favorable haplotype heifers tended to be heavier compared to those of the unfavorable haplotype heifers. That was kind of surprising for us, because as other groups had been showing that bovine chromosome 18 was associated with calving ease, we would have expected our favorable haplotype heifers to have less heavy cows. But all the other parameters we measured around calving were comparable between the 2 groups, also birth assistant. But actually we found some significant differences in the postpartum period, and I will go into further detail about that. Actually, I have to admit that I was quite disappointed when we figured out that those parameters we really thought would be different between the 2 groups, because it was our selection criteria. I was kind of disappointed. But that was the case for milk yield, as you can see in this slide. And also we examined the udder in quite a lot of detail. We did a bacterial examination, we did palpation, we did California mastitis testing, pH, milk ingredients, and so on, but there were no striking differences between the 2 groups. But I have to say again that we only supervised them until more or less day 40 after calving, because then they went to necropsy. But that's how science works, isn't it? You search for something and you find something else. In our case, we tried to do some fancy genetic reproduction, rocket science, and we ended up to have to deal with internal medicine. First of all, we were quite excited when we had this finding, because concerning infectious and metabolic diseases, it was quite impressive that the animals of the favorable haplotype showed less metritis, according to the definition of Martin Sheldon, compared to the unfavorable haplotype heifers. And that although the incidence of retained fetal membranes and all those involution of the uterus was comparable between the 2 groups. And then we had a further look to hyperketonemia, which also tended to be lower in the favorable haplotype heifers compared to the unfavorable type heifers. And although each of our animals, which was detected with augmented ketone body concentrations in the urine, because we checked that quite regularly, was treated either with propylene glycol in non-severe cases and with glucose infusion in severe cases, you can see in this slide that the animals of the favorable haplotype heifers, which you can see here with the dotted line, in comparison to those of the non-favorable haplotype with the solid lines, had significantly lower beta-hydroxybutyrate concentrations, especially in the postpartum period. You will see some more graphs now, and you can always find on the horizontal axis the days relative to calving, and on the vertical axis the respective analyte, and the favorable haplotype heifers with the dashed lines compared to the unfavorable haplotype heifers with the solid lines. So as you might know, insulin-like growth factor 1, which is a central player of the somatotropic axis, was found to be associated with ketosis and can even be indicative for ketosis. So we had to look at that, and we found that the favorable haplotype heifers had significantly higher concentrations of IGF-1, and that was not only postpartum but already antepartum. And our hypothesis is that IGF-1 in the liver antepartum, if it is higher, it induces less or it leads to less growth hormone secretions due to the normal negative feedback mechanisms with, which induces growth hormone if there's not enough IGF-1. So we had a look at that as well, and although it's quite difficult to determine growth hormone in bovine plasma, because it has quite a lot of individual variations, we found that growth hormone in the postpartum period was significantly lower in the favorable haplotype heifers. And less growth hormone means less lipolysis, and that perfectly fits together with the next observation we had. When we put the body weight, which we detected after calving, in relative to the last body weight, which was observed before calving, we saw that the unfavorable haplotype heifers lost less weight compared to, no, the other way around, sorry, that the favorable haplotype heifers, they lost less weight compared to the unfavorable haplotype heifers. So to get back to the question I posed at the beginning, concerning our experiment, we can say that the favorable and unfavorable haplotype heifers indeed did differ concerning their clinical performance postpartum. To sum up, they had higher feed intake. I have to say that was detected in the long-term trial, and that was quite nicely shown. They had less body weight loss, and that was definitely not due to lower milk yield. As you saw before, the milk yields between the two haplotypes were comparable, and in the long-term experiment, the favorable haplotype heifers even gave more milk, which was later, like after day 40 after calving. They had higher IGF-1 levels, and they had less ketosis and less metritis. So we think they have a better capacity to deal with the energy effort they have to do after parturition. So to give an outlook, based on our experiment, we can say that breeding cows with reduced susceptibility towards perpetual diseases is possible. The key factors linking metabolic and immunological mechanisms still need to be elucidated, because at this point we cannot say whether the findings we have, for example, the high IGF-1, is the primary cause for the observed differences concerning the clinical findings, or whether it is just indicative for some kind of deeper mechanism which we haven't found until now. So I want to thank all the collaborators who make this project possible. I want to thank the mentoring program from my university to give me the chance to come here to this excellent meeting, and I want to thank you for your attention, and I'm happy to receive questions.